Hi everyone, thank you so much Tina, and first of all I would like to welcome you all for this session today. Um, Let me begin by introducing myself. I'm Hardika Vira, Chief Clinical Dietitian from Luke's team, and I have also been leading the kidney vertical for him. I have over 10 plus years of experience and I have worked with multiple hospitals, fitness industries, MNCs, and here I am today in front of you all. So, without wasting a lot of time, let us, come to the main topic. When we are talking about kidney is one of the very important organs, right? We say kidney is important, heart is important, lungs is important, liver is important. Now, when I'm talking about kidney, the reason I'm talking more about kidney today is if I just look at the prevalence of CKD in India, it comes to around 17.2%, which is a high number, right? Definitely. And within CKD, there are different stages. So stage 1 to stage 5. So if I have to bifurcate it further, I would say stage 1 has around 7% of people suffering from CKD stage 1, 4.3% each for stage 2 and stage 3, and stage 4 and stage 5 is 0.8%. So yes, I understand the people suffering from stage 4 and stage 5 is less, but then if we are able to diagnose a person suffering from CKD right from stage 1, we are in a better position to help prevent, the degradation of the kidney functioning. So when you say CKD or chronic kidney disease, what it is exactly? It basically implies that your kidney function is getting reduced slowly and gradually. It's chronic kidney disease. It is also known as chronic renal failure. That means the renal is kidney. It is starting to fail functioning to its optimum level. So that is the whole idea, or that is what the term implies. Now coming to CKD specifically, right? It's a very big umbrella that I'm talking about. Within that, the changes, as I told you, from stage 1 to stage 5. Just because we have two pairs of two kidneys, right? It's a pair of kidneys, just not one organ. Even if one of your kidneys is not functioning 100% and the second one is functioning well, it is going to take care of all the functions that it is responsible for in your body. So having said that, it is very important that in case you are diabetic from a long duration of, you have been suffering from diabetes since so many years, and so is the case with regards to hypertension, or you have a family history of kidney diseases, you may want to go ahead and get your renal profile done on a regular basis. When I say regular basis, at least once a year. If there is any discrepancy in terms of your electrolyte levels, in terms of your creatinine levels, uric acid levels, you would want to be a little careful in terms of what is going wrong in your lifestyle at that point of time. This will give us a better idea, right, with regards to your kidney health. Now, moving ahead, when I'm saying all this, it's very, very important to have these routine checkups done, because it's very difficult unless you have progress to a level of maybe stage 3, stage 4, and you're not a kind of person who would go in for regular health checkups. You would really not understand that so many things have already gone wrong, or your kidney has already degraded to such a level. So this is something which is really important, which we have to be focused on. Okay, so when I'm talking about CKD and the stages, right, it is largely dependent on something called as EGFR. I'm sure most of us who has been suffering from kidney diseases, or any of our family members who are suffering from CKD or any kidney diseases, this term would be something which is very common, right? Which tells you about the functioning of the nephrons of the kidney in terms of the urine output and all of that. So basically, when I say EGFR, right, depending on your EGFR, you would be classified under 5 stages of CKD. So stage 1, wherein your EGFR is normal, which is 90 to 130 ml per minute. However, there are very slight symptoms that you would notice in terms of your kidney disorders. Maybe your electrolyte levels are a little haywire or something of that sort, and very minimal amount of change in the kidney functioning. Then going further, which is stage 2, your EGFR would be anywhere around, say, 60 to 89. Okay, so 60 to 89 is stage 2, which is mild decrease in kidney functioning. Stage 3 to stage 5, it keeps on dipping, wherein it's from say uh, uh, 30 to 59 in stage 3, then 15 to 29 in stage 4, and less than 15 in stage 5. Stage 5 also implies end stage renal disease, wherein most of the time it says that your kidney functioning is almost lapsed. So that is what these EGFR values imply. Now, having said all these, right, one thing which I constantly I was speaking about is kidney functioning, reduction in terms of kidney functioning. So why this term of kidney functioning? Very, very important. What really happens when you move from stage 1 to stage 2 to stage 3 to stage 4? Stage 3 to stage 5 are also the stages wherein your doctor, looking at your other blood parameters in terms of your creatinine, your uric acid, your electrolyte balance, they might suggest you to go in for dialysis as well. So why all these things are very, very important? What really happens? Few changes which you would notice in a person who's suffering from CKD. One is hypertension, the blood pressure, which is uncontrolled. Now, kidney is very much responsible for managing your blood pressure. Okay, so it does it via various means. So one of it is, it takes control of vasoconstricting hormones. So when I say vasoconstricting, what it is? Then consider this to be your artery. Okay, now this is the diameter of your artery. If I reduce the diameter of the artery, the amount of blood that the heart has to pump remains the same, but the pressure you have to put in for that equal amount of fluid to move in would be more, right? Thereby, it is creating more pressure on the walls of the arteries. So when I say vasoconstricting hormones, it is responsible for constriction of the diameter of the arteries. Okay, so that is one. Two is kidneys are also responsible for absorption of a lot of solutes. When I say solutes, salts, water, etc., etc. So it is responsible for reabsorption of sodium, reabsorption of water. So all these things. Consider a person who's not, whose kidney is not functioning well. These function wouldn't be occurring in a equilibrium. It is required in an equilibrium, right? Excess sodium reabsorption is also bad. Similarly, excess vasoconstriction is also bad. At the same time, when a person is already suffering from hypertension, it would create a negative impact on that person. So that is also definitely there. So we would want to be careful about all these things. So hypertension is one of the major symptoms that you would notice. Second, I would want to come up to is you must have seen for all these people who are suffering from one or the other kind of kidney diseases, specifically when I'm talking about CKD, they would have low amount of RBC levels. When you get your CBC done, you would notice that the RBC count is generally low. Although you might be taking care of, some iron-rich foods through meals and all that stuff as well, but it is low. Why does that happen? Ever thought about it? So it's because your kidney is responsible for a process called as erythropoiesis, which is secreting a hormone called erythropoietin, which in turn is responsible for producing RBCs. So your RBC, for producing your RBC, you require erythropoietin, and for erythropoietin, you require your kidney functioning to be good enough. If it is affected, it wouldn't be producing the erythropoietin at the required amounts, and thereby you would notice a dip in terms of the RBC levels as well. Coming down to vitamin D, it has gained a lot of importance these days, right? When we talk about vitamin D, I'm sure most of us must be having or must have had vitamin D supplementation one or the other time. If you would have noticed, it is vitamin D3. Has any one of you all noticed any other form of vitamin D? You can put your answers on the chat for that matter. Any one of you have noticed vitamin D in any other form? When you talk about, say, the sachets, or when I talk about, say, the liquid or the tablets, it's D3, right? Okay, great. So I got response which says D3. Yeah, perfect answer. It's D3, right? When I say D3, the number 3 suggests that there's activation of vitamin D, which is being done at 3 sites. One starts from the skin, the second activation happens in liver, and the third activation happens in kidney, which is the active form of vitamin D3, which is utilized by all our body for the functions of maybe, for absorption of calcium that is required for strengthening your bone or for other hormones for your immunity, etc., etc. It's all required in the form of vitamin D3. Now consider your kidney is not functioning well. What really happens? That third activation is generally affected. Thereby, you would notice that the vitamin D3 levels are also going on dropping. But when I'm saying all this, I am by no means telling you all that all those who are suffering from chronic kidney disease, please go ahead, buy one sachet of vitamin D3 and pop in. No, it is not what I'm trying to say. I'm just trying to say that the vitamin D3 levels are affected. It is generally on a lower end, but you would always want to keep your doctors in loop whenever you're taking the supplementation. Depending upon the range, they will suggest the same, because again, specifically with regards to vitamin D, the dosage would not be similar to what it would be for other person who's not suffering from kidney disease. We have to be a little careful about these things. Okay. Third thing which most of us must have noticed is a lot of water retention, swelling, problems in terms of urine, right? The urine output is a little lesser. So for all these things as well, kidney for that matter is very, very important, and it functions in terms of filtering off the excess waste products. It takes care of the excess fluids which needs to be removed from your system as well. Okay, with all these, when the function is not well, it is not able to filter out all these things well. It is getting affected, right? At the same time, you might have noticed now kidney, consider it to be, a sieve. Consider kidney to be a sieve, wherein it is responsible for keeping certain nutrients intact, not let everything pass through and get it excreted in the form of urine, right? However, there's some problem with the sieve. It is not functioning properly. So you may lose out on important nutrients as well. In terms of, many of us must have noticed something or heard about something called as microalbuminuria. That means the protein albumin is being lost in the urine, which ideally it shouldn't, right? Just because the kidney is not functioning well, this is something which has been noticed. So is the case with a lot of electrolytes as well. So we would want to be careful about these things. Apart from that, when you look at your blood reports, right, the amount of urea, the amount of creatinine, the amount of uric acid, these are few parameters which generally has to be in equilibrium. These are wastes. Basically, when I'm specifically talking about the urea and the uric acid, whatever is in excess is removed off from your system. But in these cases, you would notice there's an increase in terms of urea and uric acid, which just by looking at it, there are certain symptoms which you may notice in terms of, say, bad breath as such, your urine smelling really bad, or having that dizzy feeling of pukiness. Basically, you feel like vomiting every now and then, nausea, vomiting, etc., etc. So all these are because the toxins are being absorbed, are there in your system and are not excreted out from your system. So these are few things which you would definitely notice. When you talk about swelling, as kidney is also responsible for removing excess water from your system, removing excess sodium from your system. But when it is not functioning, there are high chances that it is reabsorbing more of it, which in turn causes more of swelling or water retention, basically in mostly the extremities. Right, so this is also something which you would notice most of the times. This process of chronic kidney failure, right? The name in itself, when I say chronic, it is slow and gradual process. As I told you all, I would repeat once again that getting yourselves checked if you are on a high radar in terms of with family history, with prolonged history of diabetes or blood pressure, you would want to be a little careful, because that is the time wherein we can prevent our kidneys really well. We do not want ourselves to go to a level wherein your kidneys are really affected, and then we are trying to get it back to a little normal, trying to improve our creatinine levels, when it is when the harm is done at a larger extent, right? So this is something which we would want to take care of. These are very much the changes, the pathophysiological changes that I wanted to talk about. I do understand that, as I mentioned initially as well, chronic kidney disease, it's a vast topic as such, and I wouldn't be able to talk about everything related to it in one session. So we will definitely be having more sessions about it, and we will tackle all the parts of the CKD later on in the other sessions as well. So now I'm open for question and answers. So you all can share your questions on the Q&A section or on the chat section, whatever you're comfortable with.
We have one quick question that's come up already. What test should be done? So that's okay.
So with regards to test, one thing is for sure is your kidney profile. Along with your kidney profile, you would also want to do the CBC, right? So CBC, kidney profile, and maybe urine routine is something which you would want to do as a preliminary test, right? If there's something wrong going in there, then we may want to look at other tests.
Okay. Does taking protein supplements affect kidney functioning in the long run?
It's a very interesting question, and at the same time, it's very contraindicating as well. The reason I'm saying this, if you are a kind of a person who would exercise a lot, or your kidney function is normal otherwise, and you are a lot more into exercising, or you have certain conditions, or you're suffering from illness and you're just recovering, at that point of time your protein requirements would be high, right? So at that point of time, if you're just not able to eat or meet your requirements by normal food sources, you may require it for some duration of time for that matter. But I cannot say when you're having that it is really affecting your kidney functioning if you're taking care of your hydration levels, if you're taking care of your sleep and activity levels. So if all these things are being taken care of, it is not going to harm you in a negative way. But yes, definitely, if you do not have the need of it in terms of, just for the sake of like a fad, people feel like, oh, I have worked out, now let me just pop in my protein shake and I'm going to see great results, then it is not required.
Okay, super. Another question that's come up is, what protein source should a vegetarian take? Can they substitute, non-veg like chicken, etc., with curd or milk, or should that be stopped?
Okay, so basically when you talk about chicken, fish or eggs, right, the whole idea of non-veg protein is biological value of the non-veg foods is higher, right? At the same time, when I talk about, say, vegetarian sources, cereals, pulses and all, there would be one or the other amino acid which is lacking. But that doesn't mean that a vegetarian does not meet the protein requirement or the good quality of protein for that matter. The best thing that a vegetarian could do is use a cereal pulse combination. So something as simple as, when we have rice with dal or khichdi, or whenever you're taking, say, maybe jawar or ragi along with some or the other form of lentils which is being consumed along with it. These are very simple examples that I'm trying to give you all. So you are meeting your biological value. You are getting that complete protein by itself. Apart from that, you can definitely opt for sattu. But when I'm saying this, I am talking about the protein sources in general. If you are suffering from CKD and you have your electrolyte levels up and down in terms of your potassium levels are high and all, you may want to be a little more careful with regards to the quantity of proteins or the pulses and all that you have been taking. Leaching out, when I say leaching out, soaking it in warm water for some amount of time and then throwing away the water and then cooking it in fresh water would be the best way through which you're leaching out the excess potassium, and then you can take those proteins without a lot of issue.
Okay, super. Thank you for answering that, Hardika. There's another question. If someone has sound sleep, can kidney problems cause dark circles, or is it a liver related issue?
So when you talk about dark circles, right, it's not completely related to kidney. If you have that puffy eyes, in certain kidney conditions when there's lot of water retention, it could be the case. But apart from that, there are many other aspects that you would want to look at. When you say dark circles, maybe your exposure to screen is very, very high, that it is becoming difficult for that maybe 6 to 7 hours of good sleep that you are having. It's not enough for your skin. Many of them, they have that extra pigmentation that occurs. So that could also be one of the reasons. Apart from that, what you would want to do is, keep some cucumber, or maybe use green tea bags which are refrigerated on your eyes. That will help you in reducing the darkness or pigmentation around your eyes. It could also be due to sluggish liver as such, because of which you may get these darkening of so basically dark circle kind of a thing. It's not always kidney related. You may want to understand the basic reason for it.
Right. Thanks for that, Hardika. Can creatinine levels be improved, and if so, how?
It can definitely be improved via good lifestyle. When I'm saying lifestyle, not only with regards to your meals, your hydration levels, which would definitely be taken care of depending on your EGFR. So when I'm talking about all these, I'm assuming you are suffering from CKD. Okay, so whosoever has asked this question, so I'm answering on that aspect. So in that case, we may want to look at your overall reports. When I say overall reports, in terms of your electrolyte levels, the creatinine level, what is it at this point of time? Apart from that, how your schedule is, your workouts or any kind of activity levels. Depending on that, what are the requirements? Depending on it would be your total protein intake. Your hydration levels would be described or would be designed accordingly. Apart from that, your sleep, your stress levels. So since I have been dealing with a lot of kidney patients as such, I have observed that they have a lot of so the root cause basically, or there's some emotional backlog for them. When I say maybe they are not too confident in terms of their own decision making power is a little weak. Maybe they are not too strong enough to be firm on their decision as such. They have that fear within themselves of one or the other things. So we really have to figure out what it is. The root cause may vary. So that is the another aspect altogether. But yes, we have had a lot of clients as such whose creatinine levels were really high, wherein the doctor mentioned that we would have to put you on dialysis. But in a few months, the creatinine levels came down so beautifully that the doctor said, continue what you're doing, you do not require dialysis. So that's the beauty of it, with just the lifestyle changes as such, along with the general medication that they were taking. We were able to get it down. So to give you exact answer in terms of what worked, it would depend upon person to person, because every person is different. What would work out for you would be different. Your electrolyte levels and everything would be different. So, there would be a personalized stuff which is required for you.
Okay. What about food sources for patients with high uric acid levels?
So I have already done one video on high uric acid levels and how do you get it down naturally. So you may want to look at it for more details. But just to answer your question, what is very important is that person has a lot of water, for that matter, irrespective of a person who has CKD wherein the water is restricted. If you have CKD at the same time your uric acid is high, then there has to be a middle way which we need to come up with, because for uric acid to be flushed off, you require good amount of water, ideally. Okay, so in that case, right from your protein restriction to the amount of foods that you would give, maybe ACV, apple cider vinegar, is something you can look at in terms of adding into your routine. But definitely, when I'm saying this, I am not too sure of the parameters that you have, the sodium and the potassium part of it. So we would want to know a little better about it. It's very difficult to give you a generalized tip as such from my end, because as I told you, each and every parameter is different, and depending on that parameter, the changes would also differ. So Yeah, maybe a common thing which you could do is, avoid any kind of refined sugar for sure, which causes more of inflammation, which makes your system all the more acidic. We would want to try and keep our body all the more alkaline with increase of maybe vegetables. And fruit also we would want to restrict to one at a time, because excess of fruits or fructose also, binds on or holds on to the uric acid and doesn't let it flush off. So these are a few things which you can definitely try and work on.
Excellent pointers. Thanks so much for that, Hardika. I think we have time for one last question. Does kidney dysfunction cause nerve pain in the arch of the foot? And if so, what can we do about that?
So, okay, it's a very good question, but that's not the only thing which can cause pain in the arch of the foot, right? So again, it could be due to kidney functioning as such, which is affected. It could be the electrolytes which is imbalanced, which causes an issue. Because even for nerve transmission and all, we require sodium, potassium labs and all of that as well. So I know it's a little technical, but we require the electrolytes also in range for a particular reason in our body, right? So that's definitely there. It could be due to, your B12 deficiency as well. It could be due to, certain deficiencies in terms of your calcium, your vitamin D, which is causing an issue in terms of putting in more weight. Also, check your weight overall. How much is your weight? If your weight is more, if there's more of water retention, that must also be putting in more pressure on your nerves, which is causing that twitching pain overall. So it could be a lot of things as such, which you would want to look at. I wouldn't say it's only kidney functioning getting affected, which would be, causing that pain ideally.
All right, that's all we have time for today, Hardika. If you could quickly recap, then we could close the call as well.
So basically, as we saw CKD, you would want to be a little more careful about the EGFR values that you fall under. You may want to be a little more careful with regards to, getting your checkups done on a yearly basis. Your CBC, your kidney profile, and at the same time, your urine routine. But if you're suffering from diabetes or some other condition, in that case, I would suggest you to go in for a full body checkup, right? Just to be ensure that rest of the things are going well. Apart from that, what is very, very important is kidney again is responsible right from your maintaining your vitamin D levels, your RBC levels, your salt as well as the water balance basically. So when your kidney functioning is impaired, all of these are being impaired. So you would notice there's a reduction or there's an increase or a decrease in terms of all these values in terms of the electrolytes. So we would want to be extra careful about these things. So this is about it for today. And we will take some more sessions in CKD and how do we go about in terms of holistically healing it, holistically working around it in the upcoming sessions. Thank you so much, everyone. Thank you so much for your time.